Hi, my name's Chelsea and I'm going to be your nurse today. Washing my hands. Today we're going to be doing a head, neck, ears, nose, and throat assessment. And to start off, I'm going to ask you a few quick questions. Do you have any problems with your vision, hearing, throat, nose recently? No? Do you wear glasses? And have you had your tonsils removed? Perfect. All right, so starting off, we're going to do a cranial nerve assessment. The first cranial nerve we're going to assess is the olfactory nerve, and we're going to do that by having you close your eyes and smell something. So close your eyes and tell me what you smell.
Vanilla.
Yes, that was a bottle of vanilla extract, so your olfactory nerve is intact. Next, we're going to assess your optic nerve, and I'm going to have you do that by standing up and covering your right eye. And standing 20 feet away from the Snellen chart, read the smallest line you can see.
D-E-F-P-O-T-E-C.
Perfect. And now covering the opposite eye, read the smallest line that you can see.
D-E-F-P-O-T-E-C.
Awesome. You can take a seat again. And according to the chart, your vision is 20/20, so congratulations. Next, we're going to assess cranial nerves 3, 4, and 6. And to do that, I'm going to assess your extraocular muscles by having you keep your eyes locked on this pen and with your head straight and not moving, follow the pen. All right, and we're assessing the 6 cardinal fields of gaze. What I'm looking for is uniform, symmetric movement of the eyes, as well as no nystagmus or shaking of the eyes. So perfect, I'm not seeing any of those. Now focusing your eyes on this pen, I'm gonna move it in towards your nose. Just stay focused on it the entire time. Perfect, and I saw uniform movement of the eyes as well as uniform constriction of the pupils with accommodation. Next, I'm gonna check your pupils out. Check the reactivity to light. And your pupils are equal, round, and reactive to light and accommodation. And I'd say your pupil size is about 4 millimeters today. Next, I'm going to assess cranial nerve number 5. And to do that, I'm going to palpate your masseter muscle. So if you could bite down for me. Perfect. I'm feeling uniform constriction of the muscle. And now open your mouth against pressure. Perfect. And that is also looking good. Next, I'm going to assess cranial nerve number 7, which is your facial nerve. To do that, can you smile at me, frown, blink? Okay, and I'm seeing uniform movement of the face with no drooping noted. Next, I'm gonna test your acoustic nerve by doing a whisper test. I'm gonna have you close one ear and I'm gonna whisper something into your other ear and you just repeat it back to me. So closing that ear.
Potato.
Okay, and the next.
Flower.
Good. So your auditory nerve is intact. Next, we're going to assess cranial nerves 9 and 10. And to do that, I'm going to use this tongue depressor here. And I'm going to have you stick out your tongue and say, ah. Good. And I saw uniform movement of the uvula. And I'm going to also test your gag reflex, which is present. Good. Finally, I'm going to test your 11th cranial nerve, which is having you push up against pressure. Good. And the 12th cranial nerve is just your hypoglossal. If you could stick your tongue out for me and move it side to side. You did that with ease. Your hypoglossal nerve is intact. Continuing with the rest of our assessment, I'm going to start off with your head. I'm going to palpate your scalp, looking for any lesions, indentations, tenderness, etc. I'm seeing none of those. I'm going to take an overall look at your face. Your features are symmetric. There's no edema or redness noted, no lesions, no drainage or exudate. Next, I'm going to palpate your temporal artery. And I'm looking for non-tenderness. It's smooth and pulsating. And I'm going to also assess your temporomandibular joint by having you open and close. All right, and I'm seeing no crepitus, no tenderness with that, uniform opening, which is a good thing. Next, I'm going to move on to your eyes. Assessing your eyelids, it seems the space between your upper and lower lids is symmetrical bilaterally. There's no drainage or exudate noted. I'm going to pull down here, and if I could have you look up to the sides. I'm seeing your conjunctiva, and that is pink and clear, as well as having some tiny red vessels at the bottom. Your sclera as well is white and clear, which is a good finding. Next, I'm going to move on with the ophthalmoscope, and I'm going to assess for your red reflex. So turning this on. All right. So I'm just going to have you look straight ahead at an object fixed in the distance. And I'm just going to hold you an arm's length away and check red reflex present in both eyes. Perfect. Now setting this down again. Now we're going to move on to your ears. Looking at your ears externally, they seem to be symmetric at the correct place on your skull. I'm going to palpate them. Let me know if you feel any tenderness. If there's no redness or edema noted either. I'm going to take now my otoscope. And I'm going to take a look at your tympanic membrane. To do this, I'm going to pull your ear up and back. And taking a look inside, I'm seeing an intact tympanic membrane with no foreign bodies noted. Now looking at the other ear, pulling up and back, I'm seeing an intact membrane with no foreign bodies noted. All right, next we're going to do a Weber test. To do this, I'm going to hit this and put it on the center of your forehead, and you tell me if you can hear it.
Mm-hmm.
Good. All right, and next we're going to do a Rhine test. So I'm going to hit this again, and I'm just going to hit it a little better. Now tell me when you stop hearing it. I'm placing it on her mastoid process. Okay, and now tell me when you can stop hearing it again.
Stuck here.
That's good.
I can't hear.
All right, perfect. And the time that she heard the bone conduction versus air conduction was double, meaning, which is a normal finding. I'm gonna do the same thing with the other ear. Tell me when you stop hearing it.
Are you moving it? Oh, can still hear it?
All right, and so that concludes the Rhine test. Those were normal findings. She was able to hear the air conduction 2 times longer than the bone conduction. All right, and then moving on, I'm going to start assessing your nose. Looking at the external structure, it's symmetric. There's no redness or edema noted. I'm going to palpate it for tenderness. Any tenderness at all? Good. I'm going to have you tilt your head back for me. I'm going to assess your septum. Your septum is midline and straight, which is good. Your nasal mucosa looks pink, which is also good. Moving on, we're going to go to your mouth and throat. So just looking at your lips, they are pink and moist. And I'm going to put on some gloves here, and we're going to look at your gums and teeth. Get these on. Okay, so if I could have you say ah, scat your tongue. I'm just gonna take a look in here. The mucosa is pink and moist. The tongue is pink and rough. If you could, I'm just gonna take a look in here. If you could open again. Looking at her buccal mucosa, it's pink and shiny. Her teeth are white. There's no missing or broken teeth. The bottom, there's no sign of gum disease or anything. So that is looking good. Set this over here again. All right, and then I'm going to move on to your neck. I'm going to palpate your neck, assessing for any redness, tenderness, lesions, etc. I'm going to palpate your carotid artery. It's pulsating. I'm going to auscultate it and listen for any bruise. Okay, no bruise noted. Good pulsation through that. Looking at you frontwards, your trachea is midline. And I am going to check your range of motion. Can you look up for me, down, side to side? Perfect. And that was it. That concludes our assessment for today. Thank you.